Hello everyone, my name is Min, and here's my term project presentation, Financial and Quality Analysis for Alabama. First, purpose of analysis. The purpose of analysis is to evaluate healthcare financial and quality metrics in Alabama, compare these metrics against national averages, and identify areas for potential improvement. Role in analysis. As a healthcare analyst, my role is to analyze healthcare data to aid in strategic decision making, assess the efficiency of healthcare services, and recommend improvements. Tool and data sources. The primary tool, the primary tool used for this analysis is Microsoft Excel, which facilitates data manipulation and graphical representation of the healthcare data. Importance of analysis. Healthcare help healthcare administrators make informed decisions. Analysis is essential for improving patient outcome, enhancing efficiency, and advancing medical knowledge, improve healthcare policy and management in Alabama. And here's the national versus Alabama ALS and quality metrics. ALS can use to evaluate what? ALS is used to evaluate the efficiency of health of care provided by healthcare facilities. It help understand how long patients typically stay in a hospital, which can influence resource allocation and management. Why ALS is important? ALS is important because it impacts hospital resource utilization, cost of care, and potentially the quality of patient outcomes. It is crucial for operational planning and performance assessment. How is ALS calculated? ALS is calculated by dividing the total number of inpatient days by the number of discharges. Cost per discharge can be used to evaluate what? Cost per discharges evaluates the financial efficiency of a hospital, indicating how much on average each discharge cost the facility. Case mix index is used to evaluate what? CMI is used to evaluate the complexity and resource requirements of the cases treated at a hospital. Why CMI is important? A higher CMI indicates that a hospital handles more complex cases, which often require more resources and specialized care, impacting financial and clinical outcomes. How is CMI determined? CMI is determined by averaging the DRG relative weights for all discharges, reflecting the diversity and complexity of clinical cases treated. CMS monitor readmission as a measure of what? Readmission rate are monitored as a measure of hospital quality, indicating how often patients return to the hospital after discharge, which could suggest issues with initial care quality or discharge planning. Patient survey from the CAHPS is a measure of what? Patient survey from CAHPS measure patient satisfaction and perceptions of care, which reflect the quality of service provided by healthcare facilities. And next one is the top five state versus national DRGs by discharge. And here's the graph for it. Analysis and graphing. How can you use national data to assess the health of your state? First one, benchmarking. You can evaluate the performance of your state by contrasting its healthcare indicators with the national averages. Should your state's measurements exhibit a notable deviation from the national averages, it may suggest either strength or areas in need of improvement. Second, fighting trends. Broader healthcare trends or patterns can be found using national data. You can predict future opportunity or obstacle for the healthcare system in your state by examining these trends. Third one, policy creation. State level healthcare policy creation can benefit from from an understanding of federal healthcare trends and policy. It enables legislators to create laws that specifically meet the requirements and difficulties faced by their state by drawing lessons from the effective tactics used in the other state. And last one is resource allocation. Information from national statistics can be used to understand how resources are allocated. For instance, your state can allocate resources appropriately to satisfy the demands of its population if particular healthcare services or specialties are in high demand across the country. Can the frequency of DRGs help a healthcare administrator in anticipating the care and the cost needs? Patients are categorized into groups using DRGs according to comparable clinical circumstances and required treatments. Administrator can do the following by examining the frequency of various DRGs. Determine typical medical condition and procedure. This aids staffing, resource planning, and guaranteeing that supplies and equipment are available. Budget for medical expenses. Administrator can forecast revenue stream and adjust their budget by knowing the frequency of a given DRG, as different DRGs have varying reimbursement rates. Make a plan, specialized care. If certain DRGs appear more frequently, it can mean that specific medical areas require specialized services or knowledge. Administrator can then deploy resources and hire specialists as needed. How do pie chart help with distribution comparison? Pie chart, which graphically depict the proportion of several categories in a dataset, are useful for comparing distribution. To effectively communicate distributional information to a broad audience, they highlight dominating categories, offer a clear depiction, make comparisons of proportion symbol, and are simple to understand. Next is the chart for performance analysis of top 5 hospital by discharges, and you can take a look at it. We have Huntsville Hospital, UAB Hospital, DCH Regional Medical Center, Renville Medical Center, and last one is Mobile Infirmary. And next is the AOS and cost per discharge analysis for the top 5 hospital. Top 5 hospital by discharge for Alabama analysis. Which hospital had the highest discharges in your state? Huntsville Hospital had the highest discharges in Alabama, which is $10,047. Which hospital is the most expensive? Renville's Medical Center is the most expensive, which with cost per discharge of 166,000, 166,108 dollars. Which hospital is the least expensive? Mobile Infirmary is the least expensive with cost per discharge of $38,332. What does CMI mean? Case mix index is measure used in healthcare to assess the complexity and severity of patients treated within a hospital of healthcare facility. How can this measure be used? CMI is a valuable metric in healthcare management and decision making, providing insights into the complexity of patient population, resource utilization, and financial performance of hospital and healthcare facility. Which hospital has the highest CMI? UAB hospital has the highest CMI. And which hospital has the lowest CMI? DCH Regional Medical Center has the lowest CMI. Next, which hospital has lowest patient satisfaction? What does that mean? DCH Regional Medical Center has lowest patient satisfaction, which may indicate problem with the standard of care, patient experiences, and general hospital service satisfaction. It might point out places where communication, patient care, and general hospital operation need to be improved. Which hospital has the highest patient satisfaction, and what does that mean? UAB Hospital and Grandview Medical Center has the highest patient satisfaction. This suggests that patients at this hospital are likely to have a good experience and be very satisfied with the care they receive. This can be indication of the hospital dedication to excellent patient care, patient-centered procedures, efficient communication, and general healthcare delivery excellence. And here's the top 5 discharge DRTS for Chin Regional Medical Center. And here's the comparative analysis for Chin Regional Medical Center DRTS to state. Efficiency and cost analysis of Alabama Top Hospital. And here's the some key of metric analysis: ALOS versus cost per discharge. High ALOS with low cost is Huntsville Hospital, which ALOS is 6.1 days and cost is $78,078. Low ALOS with high cost is Randview Medical Center, which ALOS of 5.1 days and the cost is $166,108. CMI versus cost per discharge. High CMI with low cost is UAB Hospital with a CMI of 2.52 and the cost per discharge is $124 and $324,360. Low CMI with high cost would be DCH Regional Medical Center with CMI of 1.73 and the cost per discharge is $43,137. Observation and recommendation. Huntsville Hospital show excellent management for its ALOS. Renview Medical Center may need to investigate high costs despite lower ALOS, and UAB Hospital efficiently manages complex cares with controlled cost. DCH Regional Medical Center can improve on managing simpler cares more cost effectively. Actionable steps. Review operational practices at Grandview Medical Center and DCH Regional Medical Center. Consider adopting UAB hospital strategies in managing complex cases across other facilities. Conclusion and strategic recommendation. Summarize key finding unique features of Alabama healthcare landscape and specific hospital characteristic. Provide strategic recommendation based on the analysis to enhance healthcare delivery in the state. Some summary of finding. State and national comparison. Identify area where the state excel or lags in healthcare metrics such as ALOS, cost per discharge, and DRGs compared to national averages. Hospital performance analysis highlighted difference in hospital efficiencies and area for improvement based on ALOS, CMI, and cost per metrics. Key insight: efficiency gaps. Some hospitals show high costs associated with lower complexity cases, indicating inefficiency. Quality of care. Hospitals with higher CMI and lower cost per discharge are effectively managing complex cases and controlling cost. Strategic recommendation. Operational improvements such as implementing process optimization in hospital with high cost and low CMI to improve cost efficiency, quality initiative, recommend adopting best practices from hospital managing complex cases effi- efficiently to other facility to elevate care quality and patient satisfaction, future direction, data monitoring. Continue monitoring hospital performance metrics to quickly identify and address emerging issues. Investment in technology. Advocate for investment in advanced healthcare technology that can improve patient outcomes and operational efficiencies. Role and objective. As a healthcare analyst, my task was to assess efficiency and guide improvement across Alabama Hospital. Second, state features. Predomin- Predominantly rural with significant healthcare access challenges, recent mergers, and ACO initiative impacting healthcare delivery. Hospital highlight 10 regional specialized in complex care, evidenced by high CMI noted for extended AOS in intensive treatments. For its keep fighting variability in AOS and cost efficiency across hospitals. Some hospitals show high cost with low complexity care. Recommendation: state level encourage efficiency program for high cost DRGs in 10 regional, exploring reducing LOS where possible without affecting care quality. Next step: regular review of performance metrics, implement changes in collaboration with hospital management. And here's the screenshot for the access. And here's my references. And thank you. Thank you for your time. And that is it for my presentation.